My name is Mark Miller. Pardon my voice. I was in America, and I was diagnosed with one of the most rapidly growing, lethal cancers ever discovered. And when I sought advice from my top-tier American doctors, they told me that they had nothing for me and that I will die in 6 months or I will die in 7 months if they gave me radiation burns all the way down here and injected me with massive chemotherapy making me vomit. Right now I'm in Beirut with Dr. Habib, and I've received treatment. The treatment here, actually, I could detect the treatment. It's inside here, and I cannot feel this. But up here I had tumors this big, 2 of them over here, and within 5 hours, half of a day, those went away, completely away. I cannot, there's not here. They're here, and they're completely gone. And that's in 5 hours. And now it's been a couple of weeks, and I'm receiving a lot of treatment. And then they did a test on me, and it was reduced from this big to that big.
Hello, I'm Dr. Ronald Whaling. I'm from the United States of America. I am a licensed and trained naturopathic medical doctor. What that means is that I look for all different types of therapies that could be of benefit for people suffering from chronic degenerative disorders as well as cancer. He was diagnosed with anaplastic thyroid cancer. Now, anaplastic thyroid cancer is a very rare cancer in the sense that is only 1% of all thyroid cancers is anaplastic thyroid cancer. The other problem with anaplastic thyroid cancer is it is extremely rapidly growing. In fact, it grows so fast, it outgrows the therapy that we can provide to try to treat it. I have traveled all over the world looking at different therapies for different types of conditions. It was recommended to me through someone else who had come to Dr. Habib's Institute to get treated for 4th-stage breast cancer. Turned out to have total remission of their cancer. Based on some of the research I did on the therapy, I advised Mr. Miller to come with me to Lebanon to undergo this therapy, as I believed it would be an effective therapy for what he was suffering from. His doctors had given him virtually a couple months to live. They did not recommend any other cancer therapies for him, as they did not feel they would be of benefit.
They recommended chemotherapy and radiographic at massive levels.
Yes.
And it would give me 1 more month of very bad health.
Yes.
About 1 more month to live.
Yeah, they thought they could extend his life by 1 month using conventional therapies. We came here, we started the therapy, and I have to admit, and it was beyond my belief as well, that 10 hours into the therapy, we could no longer feel those lesions. He had an intense tightness in his neck, again as a result of the tumor with pressure going into the throat. That had lifted, again by the end of the first day. We've been here close to 9 days now for therapy, and he's been getting his IVs intensively every day for those 9 days. He has continued to improve. We are now ready to go back to the United States to do a cooperative effort with Dr. Habib and to help to prove this therapy as a very viable protocol for treating not just types of cancer that Mr. Miller has, but other forms of sarcomas and melanomas. I wish to thank the government of Lebanon and the medical community of Lebanon for allowing Dr. Nabil Habib to be a pioneer in the discovery of new beneficial methods for the treatment of cancer. And it will be a great service to all of mankind to come in the future. Dr. Habib, in my opinion, is a great thinker. So to me, Dr. Habib is another one of those greats that will go down in the books of history as being a great thinker and a discoverer of a wonderful new therapy for the benefit of treating cancer. Thank you.